In 2015, Park Dental formed a unique partnership with a group of physicians to go above and beyond oral health care. This project works to identify and treat patients who suffer from sleep apnea and other sleep-related disorders.
The practice of sleep medicine and the treatment of sleep apnea is very much a team sport. There's no one specialty that actually can handle the whole spectrum of the disorder. Dentists are in a key position to treat and identify patients with obstructive sleep apnea. When dentists look into the mouth, they see a lot of the signs that might point towards sleep apnea as a possibility. And just a few questions later, they could identify somebody with a really life-threatening problem.
The partnership involves the coordinated efforts between multiple healthcare organizations, Park Dental, and the Facial Pain Center, offering a new standard of care for Park Dental patients.
We're screening every single patient that comes into our practice because with sleep disorders, you don't actually know who has them until you start asking the right question. They would fill out a form that has a scale that kind of measures that subjectively. If they score high enough on that test, we can identify those people and get them to a physician to diagnose a sleep problem.
We subsequently then would diagnose the problem with a sleep study, which is usually done in the patient's home, and we talk about the various treatment options for the patient. And if a dental device or continuous open airway therapy is an appropriate treatment, we would refer the patient back to Park Dental dentists and have their experts help us with the therapy and then see them back.
20 years ago or so, the standard of treatment for people with obstructive sleep apnea was what's called CPAP. Now these oral appliances have become much more popular, and there's more research and data that supports the evidence that shows that these are very effective.
It's fair to say that about 10 to 15% of the population has sleep apnea to some degree of severity. The estimates are that there are about 80% of patients with sleep apnea still undiagnosed in the United States.
This is an example of one of these oral devices that are used for the treatment of obstructive sleep apnea. And the way that this works, very simply, is it moves your lower jaw forward. My lower jaw comes forward, and the device allows that to occur. You're able to sleep much more effectively and breathe easier because your oral airway is open. Patients with mild to moderate obstructive sleep apnea have very high success rates with these devices, somewhere in the 80–90% range. The advantage of these oral appliances are the size is small, less disruptive to your bed partner, transportability, but the most important thing I think is the clinical effectiveness.
This effort was identified as an opportunity through Park Dental's Vision 2030 initiative. The core purpose of Vision 2030 is to improve people's lives as a leader in oral health. This collaboration brings this goal to the forefront of Park Dental's care in new and exciting ways.
Dentists actually have a unique role because they see the patients every year. You have a large number of patients that physicians actually never even touch. So you have the ability to really impact care for a population that is far beyond what even a physician can do in their office.
We want to be a provider of oral health, and of course that's going to be our main focus for the future, but we also realize that good oral health means good overall health.
The important thing here is that we are creating an integrated approach to healthcare, bringing very important condition that is obstructive sleep apnea and other sleep disorders into the dental space.
Park Dental is positioned to really lead the way in how physicians and dentists can collaborate in the care of these patients.